The next group of disorders we want to talk about is anxiety disorders. Anxiety disorders are the largest group of psychological disorders, the most common when we talk about the big group as a whole. In anxiety disorders, the first one is generalized anxiety disorder, also known as chronic anxiety or free-floating anxiety. A person who suffers from GAD is constantly worrying. Now, this worrying oftentimes leads to more worrying, which leads to more worrying. It's a vicious cycle. So think about the time when you're anxious about whatever it is, and now multiply that by 6 months straight. The person is constantly feeling something bad is going to happen to them, and they may be confined to their house. The next one is a panic disorder or panic attack, and this is a sudden onset. A person experiences overwhelming feelings of dizziness, heavy breathing, rapid heart rate, as if they're going to die. And many people who suffer from panic attacks cannot pinpoint the reason as to why they're having a panic attack. So the goal of like a therapist would be to identify, all right, what's causing or what's precipitating this attack, and working to get the person to overcome these feelings of anxiety. Next one is a phobia, and a phobia is an irrational fear. Again, we're gotta stress irrational. So a person who's afraid of clowns, well, it's probably an irrational fear, unless of course they were attacked by a clown when they were younger, which then makes perfect sense as to why they would be afraid of clowns. But most people probably have not been attacked by a clown before. One of the phobias which you need to focus on, need to know, is called agoraphobia. And agoraphobia is a person who is afraid of open spaces. So a person who goes down to Milford Memories, maybe in the summertime, would have a hard time because they're in an open space. They constantly fearing, well, what if something bad happens to me? How am I going to get out of here? And severe agoraphobics are, maybe confined to their bedroom, that they can't leave their house just because they're so afraid of going out in public. Obsessive compulsive disorder. So obsessive compulsive disorder is a disorder that must engross their life. So checking your alarm clock 3 times a night is not an example of OCD. The obsessions are thoughts. So it's important to know obsessions are thoughts. Compulsions are actions or behaviors to relieve these thoughts. So a person takes part in these compulsions to help get rid of these thoughts. So a person is constantly thinking that, did I turn off my stove or not? That is the obsession, and the compulsion is constantly going back to check to make sure it's off. You could say washing your hands. So the person is feeling that, there's germs on my hand, I didn't get everything clean, and the compulsion is to wash the hands. So a behaviorist such as B.F. Skinner would say, well, one reason why they're doing this behavior is to get rid of this anxiety. So that kind of feeds into this, reinforces the behavior, because by washing their hands, it gets rid of these feelings or these thoughts of uncleanliness. Next one is post-traumatic stress disorder, PTSD. And someone who suffers from PTSD is a person who has suffered some sort of extreme psychological trauma, such as someone who has gone to war and returns from war. Some of the symptoms include nightmares, easily startled. These constant memories of the situation, they try to avoid similar situations or any sort of environment that may trigger that memory to come back. PTSD can be a lifelong disorder, and very difficult for a person to get over, and because it's the traumatic experience. A shorter one is called acute stress disorder, and acute stress disorder may last for a couple days, maybe a week or two. So this is someone, maybe you got into a severe accident, and for the next week or two you have a hard time getting into an automobile. Every time you get into an automobile, you feel nervous, you feel anxious, maybe you have nightmares about the car accident, something of that nature. But that's the acute one, so it doesn't last very long. Alright, so that's just a quick little rundown of anxiety disorders. Stay tuned for other ones.